All right, on behalf of the National Eczema Association, I'd like to welcome you all to our presentation, which is, of course, Holistic Eczema Management for Infants and Toddlers. I'm your host, Nora Eigenbrot, with the National Eczema Association this evening, and I am delighted to introduce our presenter, Samantha Casselman, DNP, CPNP-PC. Samantha owns a pediatric dermatology clinic in Phoenix, Arizona. She has specialized in pediatric eczema since 2013. She provides holistic and comprehensive care in person and virtually for families across the country. She is also a leader in the National Association of Pediatric Nurse Practitioners organization. And with that, I am pleased to hand it over to our presenter, Samantha Casselman.
Thank you so much, Nora. Thank you to Nia again for having me back for a webinar. Today, we're going to talk about holistic eczema management for infants and toddlers. Next. I wanted to start with a little bit about me. Who is this girl that Nia keeps asking to do different eczema things about? So I'm located in beautiful and sunny Phoenix, Arizona. I've been here since I was 4 months of age. I was adopted from South Korea. So I do come with a little bit of that sensitive Asian skin. I battle a little bit more with contact allergy issues. I definitely have bouts of eczema. Sweat is a big issue for me. But I started my career in nursing in 2007. I started as a certified nursing assistant, moved into the RN role, and then into my doctorate of becoming a pediatric nurse practitioner. And during that time in the dermatology clinic in 2013, when I started as a nurse, that's when I really started to grow such a fond love for the egg community. Almost a majority of my day would be spent in triaging phone calls with families, and I started to notice trends. So I add in here that I do have a little bit of an analytical side to me, having a history in clinical IT, and bringing all of those pieces together with my history. Thank you again to Nia for having me as a speaker at the patient expos. Shout out for the expos if you haven't been there before. It's such a strong and wonderful community where you can feel heard and observed and really kind of share in your experiences with eczema. But all that to be said, my hope is today, both for clinicians and for families and caregivers, that you can walk away with some good tips taken from my years of experience managing and helping families with atopic dermatitis. But it really comes from a little bit more of that analytical lens. And when we talk about holistic, we're really talking about your whole child, your whole neonate, your whole infant. What are all of the things that we can be considering? And especially so if you're a provider listening to this talk, maybe you work in primary care and you're really wanting to get more proficient in treating pediatric eczema because you see it so commonly. I'm really hoping that this sparks some interest in some areas that help you to holistically treat your families. Next. We're going to work with these kind of dyads of framework. There's multiple things that we can consider in management for infants and toddlers with eczema, but I kind of parse them out into these sections because we, number one, should have a dedicated mindset around thinking about each of these areas, but these are common things, especially for any patient who has moderate to severe atopic dermatitis, to allow you as a caregiver to feel that you're getting all areas of your child's needs met. Next. But first, we have to get back to baseline. We have to review skin and gut maturity. There's a really strong importance for understanding the natural maturation, meaning the maturity of our skin and our gut, and that could either positively or negatively impact your baby with eczema. Next. So let's first understand the skin barrier. Next. Big shout out to L'Oreal. These next couple of slides in my partnership with them in both using their products and learning more about their products. They have a couple slides for me that I really ask them to use because they really formulate the really key important foundations of the skin barrier and why we would choose particular products to help to repair that skin barrier. Neonatal skin can cause major skin barrier dysfunction. Thankfully, lesser so for all neonates, but in eczema-prone kids, maybe a little bit more barrier dysfunction that you need to expect. But baby skin generally has about a 30% thinner stratum corneum, and that's just that kind of top layer of the skin. They also have elevated pH levels of the skin, so different than what an adult skin pH level would be. They also tend to lose a little bit of water called transepidermal water loss from their skin more commonly. They have harder times regulating hot, cold, and because their skin is more fragile, they can also be more prone to infections and thermal damages. One thing to consider next is that skin maturation doesn't take place fully until about 2 to 4 years of age. So remember that age because when your baby's born, they don't have the skin that they will have as an adult. And as the skin matures, it will slowly be growing towards that maturity to be stronger, not as sensitive, not as prone to infections. But that might not happen until they're 2 to 4 years of age. Next. Next. I did those backwards. So the goal really of the skin barrier is to get it back to normal. The stratum corneum, you want to think about it as a brick and mortar concept. The stratum corneum has all of these brick layers to them. And if we don't have really strong lipid barriers in the middle of these layers, think of that as the mortar in between the bricks, then the integrity of the skin is going to break down more commonly. So the inner makeup that is hidden behind this little box here talks about 50% of that lipid makeup is going to be ceramides. Then you're going to have some cholesterols. Then you're going to have some fatty acids. And if you're a mom who's watching this webinar and you're like, hey, I've had a history of eczema. When I have a baby, are there things that we need to consider? The picture down at the bottom is a picture of a newborn with this fetal-rich ceramide-rich coating called the vernix caseosa. The AAP actually recommends that you don't wash that off right away, and that might be different than what you might have heard from even like your first baby, depending on when they were born. But these ceramide-rich elements to the skin and that mortar part of our skin that I talked about with the good healthy lipids in them, the cholesterol levels, those are all things that help that mortar of the bricks of our stratum corneum to be stronger so that when even simple things like rubbing on skin is not going to break down as readily in a person who has normal skin compared to somebody who has eczema prone skin. And there are ways that we could strengthen that mortar piece that we'll further talk about later in the presentation. Next. Now getting onto the gut. Next. There's also phases of gut microbiome development. When babies are born, colonizations and different microbiota is kind of forming in that 0 to 6 months of age. And then as kids get older and they start to take in new foods and diversify the foods that they're eating, the microbiome is going to be ever changing between about that 6 to 24 months of age. Move into 2 to 3, the microbiome will start to resemble that of adult-like structure, but by about 3 to 5, that's when you have that full maturation. And remember that our skin was also slowly developing into maturity during this time frame. Next slide. And so when it comes to our gut, there are specific factors that can impact gut health in infants that we see through research. And research is needing to catch up with some of these anecdotal things that clinicians may be observing in the clinic. But there are early life factors that do look like they support a healthy microbiome. Here's some plausible strategies to reduce eczema risk. You want to avoid unnecessary early antibiotics for mom when she's pregnant, as well as babies when they're younger, if they're unnecessary. You also want to support breastfeeding when that's appropriate and possible. And then you want to actually encourage a diverse, low sterile household environment. What does that mean? Not vigorously clean off every single substance, not vigorously cleaning off your baby several times a day. We need to obviously live within safety norms, but we don't necessarily need to be creating this overly sterile environment. Probiotics given prenatally to mom and postnatally to infant before eczema has developed has actually shown in data and research to show evidence of modest eczema prevention in some at-risk population. It brings a little bit of hope for that prevention piece, right? But you always want to discuss this with the particular strains that you may be using, the timing and the evidence with your providers before you just jump right into starting any treatment, especially for our pregnant moms. Then a little bit less kind of like a sad face, maybe can pop up onto the slide is that for infants with established eczema, while many of you may anecdotally have seen that starting a probiotic or a prebiotic have been helpful for your child's eczema, we just don't have research to fully support that with all or a majority of infants with eczema. So conventional medical treatments remain first line, but research is still ongoing, of heavy interest to individuals like myself. So hopefully down the road, we will start to see that things are starting to get more heavily into the category of evidence-based probiotic use in young babies. We'll just have to wait and see. Next. So maturity factors are really pretty crucial to consider. Our babies are developing on so many different levels. Our skin, our gut, and our development of these babies are all key factors that can really negatively impact your child's experience with eczema. Next. But take heart. Babies, oh, babies mature in all of these areas. Understanding your baby's development and implementing reasonable interventions can empower you to choose customized treatment plans for your child. Next. Now we're going to talk about those different frameworks around holistic planning. Now, if you are like me and you like to take notes, there's key frameworks that we're going to consider, key considerations within those frameworks. So when we're reading through these, really kind of think through, oh, that's something that my provider hasn't ever talked to me about. That would be one piece of your child's eczema journey that you would maybe want to talk about the next time that you go in. Next. So first off, medical and clinical care. We have to have an accurate diagnosis. Nia has other presentations that you can watch for how to treat atopic dermatitis, all the treatments that we have. But if we're not dealing with eczema, then that leads you in a completely different direction. You got to get the right diagnosis. Then from there, you have to be taught what to expect specifically for your child when it comes to potential triggers, as well as just normal everyday common triggers. You have to also understand that children with atopic dermatitis and eczema have an increased risk of getting infections. And you should also understand what each of those infections can look like in eczema. Are you dealing with a bacteria, a yeast, a fungus, a virus? Hopefully not a combination of all of those things. But specialist involvement, especially for children who have moderate to severe atopic dermatitis, is going to be very common. I think about it in this light. When you have a cancer, it's a really specific diagnosis and a really targeted treatment that we need for that type of cancer. Now, even though eczema does affect, on average, about 1 in 5 kids, is one of the most recent stats that I've heard. When it gets to moderate to severe atopic dermatitis, we really need to get to specialists who have a passion and interest, knowledge in the most up-to-date evidence-based practice for atopic dermatitis management in infants and kids, more specifically, kind of leaning into their experience with children, because thankfully, a lot of kids will grow up, get to that maturity factor, and not hopefully battle as much with eczema. But having those specialists involved in your care can really be that breath of fresh air so that you're finally with somebody who's thinking a little bit more holistically about your eczema management. Next. Then, of course, coming from a pediatric derm provider, skin and environmental care are always going to be first step. I always talk to my patients about we really just need to get the skin back to normal or as normal as we can achieve for your child. We need to talk about skin barrier care, trigger avoidances, infection prevention, and addressing and controlling itch. Now, that is certainly another topic to find another webinar to dive a little bit deeper into controlling itch, because if we're not controlling that itch, we're never going to help get that skin barrier back to healing. Next. Then there's key considerations to nutrition and feeding. I cannot have an appointment with a neonate. Well, I guess I should say, I don't normally see neonates in my clinic for eczema. I'd say about the average age of infant eczema starts around 2 to 3 months of age. But every single appointment for my new patients, parents are really hungry to know, well, what should I do with nutrition? What should I do with feeding? What's safe? What's not safe? And there's a really kind of key takeaway I want you to have when it comes to nutrition and feeding. We need to focus on nutrient-rich foods. We need to really make sure that our kids are getting the nutrition that they need. We also need to monitor their growth charts, make sure that they're flowing in that trajectory of growth that they're supposed to be, not stalling or even going down. We need to support breastfeeding and formula needs, introducing allergens per guidelines if it's safe, and then also considering proteins, vitamin Ds, zincs, iron intakes, and really, truly, guys, avoiding unnecessary dietary restrictions if it's not relevant for your baby. Next. So I made a little table here because there's a lot of different feeding introduction tips, and don't take this away and say like, oh, Sam said that we have to follow these things for eczema to your pediatrician. I always want you to fall back on your pediatrician for guidance as far as how to feed and time and those cues that your baby's showing you and what foods they want you to introduce first. But this is kind of a summation of timing, high-risk allergens, order of foods, introduction methods, safety, maintenance, and feeding practices with supporting evidence. Take home, early, diverse, and safe food introduction, especially with peanuts and eggs, even around 4 to 6 months of age, is strongly supported by evidence to reduce food allergy risk. And if your child does have sensitivities or reactions, you certainly need to include both your pediatrician so they know what's going on, as well as a pediatric allergist so they can help you understand if there's that gray zone of irritation or if you're dealing with a true IgE-mediated allergic reaction. Next. Next, some key considerations with holistic and complementary approaches. Some of you may be thinking, yeah, I logged on to this session because I want to hear about all things integrative. Well, some key considerations around this really include seeking appropriate complementary approaches for your child and for your family's preferences. A lot of my discussion in my clinic is, well, did you have any specific ingredients or specific products that you wanted to talk about? Because I need to meet my parents with where they're at, where their interests are at. And I don't want families to come in and just push my own treatment plan. It needs to be customized for each family. But I would push that we need to consider for evidence-based things and understanding that all natural things are not necessarily safe on the skin. We talked about evidence-based use for probiotics. There are safe and natural oils and emollients that you can consider for your baby. We also, I always discuss complementary therapies, and that just kind of means you've got your skincare plan, you have your medications that you want to use, but what are all these other things that you could be doing to calm the skin, help that microbiome, help the skin get back to normal? And we could choose those things carefully. Lastly, I really like to encourage families to have a stress reduction strategy around kind of managing all these things. And that kind of comes down to choosing one product at a time, maybe a couple, not stressing yourself out about trying all of the different things. And then there are really specific ingredients that I want you to consider that you would actually want to avoid. Next. If you haven't heard of contact allergies, then this is the time to kind of just take that information in and recognize that we can be allergic to foods and plants, but when we're allergic to ingredients in skincare products, that's not necessarily a reaction that you're going to see immediately. If your child is allergic to a peanut, they're going to have an immediate reaction to that peanut with subsequent exposures. When it comes to pediatric contact allergy ingredients, the more you expose, especially on open eczema, that skin barrier is broken, the more you're actually sensitizing your baby to develop skin allergies or irritations. These are some of the ingredients that can cause contact allergies or contact irritations. Patch testing is what you can utilize even in younger babies to consider if there is an ingredient that now has been sensitized and used on the skin so often that now they actually have an allergic reaction to it. I told you at the beginning, I suffer from a lot of contact allergens. I can't wear earrings very often because nickel for me is a high contact allergy. But when I wear that nickel, say on a Saturday to go out with my husband, then I will have an itchy ear for that day, the next day, but that itching and the rash actually build. So the way you do patch testing is you go into the office, You put patches on whatever part of the body that they choose to do that. And then they leave those on for 3 days. They take that off on a Wednesday, do a first interpretation of what that rash may look like. But the worst of that rash, guys, may not happen all the way until 5 days later. That's super confusing. If you didn't know that using a particular skincare product on the skin could result in an allergy, but that allergy might not be as exuberant or at its worst until 5 full days later, you wouldn't know to put those correlations together. One shout out for an allergen that isn't listed in the top 10 here is also one called lanolin. And lanolin you have to look out for in ointments and diaper paste type products. Next. If you want to learn more about an integrative approach to atopic dermatitis, I highly recommend that you learn from the GOAT of integrative approaches to pediatric atopic dermatitis with Dr. Pito Leo. I found this video of him speaking about these topics. Have a QR code for you here if you want to go on. This is definitely not enough time in this webinar to cover those topics, but Dr. Leo is definitely considered our expert in this area. Next. Next are key considerations for development and behavioral health. We need to have you pay attention to sleep and sleep patterns, play and distracted play, emotional well-being, and development. These areas cannot be overlooked. Establishing good sleep routines to help your child both fall asleep well and stay asleep well are very important because itch is such a nasty part of atopic dermatitis. Then you want to encourage your children to play and have a normal development and a normal play schedule, but you might need to consider that if they have open areas of impetigo and infected eczema, that those areas are closed up, or maybe they need to take a day to where that is taken care of with whatever medication regimen that your provider is giving you. But in general, you want your kids to be able to play and socialize as regular. You also want to consider some strategies for distraction. We are in an era, whereas I'm a mom as well. My children are 13 and 9 at this point. And for me at this age, fighting with the balance of screen time is really difficult, right? However, when it comes to your children with eczema, while I'm not saying put a screen in front of their face all the time, but if what I am saying is that if you have a child and they're experiencing an eczema flare, and when they flare, you may have noticed that your child can go through different itching fits. They're flaring, they get upset, and they start to scratch at spots. When that's happening, you need to have some strategies to help them both calm down, regulate, get distracted, and using certain toys or certain distractions or something that'll be really helpful. Because again, back to that skin barrier dysfunction, once they start scratching and breaking open the skin, now that's when you're getting into that vicious itch scratch cycle that we need to get them out of. Next. Last but not least, key considerations for family and caregiver support. I really hope that you walk away feeling that your healthcare provider is really helpful for you in all of these areas and these domains that I talked about a holistic approach to managing newborn and infant atopic dermatitis. If you don't feel like you have that partnership, don't lose hope. Now you have a guideline to go to your provider and say, hey, I had this question about this area of their development or their sleep. And it seems like their eczema kind of negatively impacts that. I hope that you can feel supported with your healthcare provider to get those answers. And we never want to say, oh, leave the healthcare provider, don't see them again. But I do hope that you can find that partnership, that shared decision-making partnership with your care providers so that you can get to healing as well. I would hope that your providers are teaching you correct medication applications, providing trigger identification and training, aligning routines. If you've got separate households or if you have grandparents who come and take care of the kiddo while parents have to go and work during the day, that they offer caregiver stress support if they have questions about that. So that's an awareness of NIA, the different online support groups, the patient expo that they can get into, or even just local support groups, or also just connecting with parents and peers. Next. So we're going to settle in for a second here and kind of walk through what I utilize that really covers many of those domains that I reviewed. This is what I utilize for something called an eczema action plan. Eczema action plans are kind of created off of the concept of managing asthma and managing seizures. In those two different diagnoses, when kids are doing well, they may be using particular medicines. When they're worsening with an asthma exacerbation, now they're in the yellow zone, they're going to use different medicines. This was modified from that concept. This eczema action plan is actually utilized with permission from the Bristol University in the UK, who originally made this format of this particular eczema action plan. But this is supposed to be customizable. There's an algorithm as well. What I do in my clinic is I pull this up on the screen. I show parents specifically, this is the plan that you do every day when you're not flaring. This is the plan that you do when you have red itchy skin and you are flaring. And then we do mark these check boxes for the medications that are relevant for that appointment. And then we update that if we need to every time that parents come in for a visit. Then my platform that I use in my clinic utilizes a HIPAA compliant texting platform. And so I just send them a PDF copy of this eczema action plan. So each time they can go home and they could really understand and synthesize all of these multiple steps that we're asking about. You might be thinking like, gosh, Sam, you've asked us to consider all these different domains. I'm already in like brain overload. Having something either that you've taken notes on or something that your provider is giving you is also another good sign that you have a healthcare provider that's on your side and also really dedicated and fully interested in eczema. So let's break down what the EAP is. So every day when the skin is flaring, not flaring, sorry, that's the green zone. In that green zone, you still want to utilize particular skincare products that are going to maintain the skin barrier. You also want to use cleansers that are not going to take the pH of the skin out of the healthy level. And depending on your child, you may have a medication for what we call maintenance treatment, medications that help to prevent flares. But you'll notice that in the green zone, moisturizing creams, moisturizing lotions are going to be common. But when you move down into the yellow zone, that's the area that if you have a spot on the skin that is both red and bumpy, rough, and itchy, now you're probably needing to focus a little bit deeper with your eczema management. And that means that we're going to do a switch in skincare products. Step one, we have to relieve dry skin. I really like balms. Balms, especially the Cicaplast product from La Roche-Posay, has a little bit of zinc. It has different prebiotic that helps with the microbiome and really just gets you to healing. The most important reason why you don't use those creams and lotions in the green zone down in the yellow zone is because they really sting the skin. Probably everyone who watches the webinar can be like, yeah, I've used a product on the skin of my baby and they were screaming after I put it on. Why would I continue to do that? Well, now you know that if you utilize balms or ointments on the skin, those are not going to sting the skin. And that's just because of the ingredients that are utilized in the product. It will be adding moisture into the skin by using a balm, and then you're going to be protecting the skin with that barrier with something like a CeraVe healing ointment. Then you may want to utilize products that help the microbiome with the products that you wash with. There's also products that kind of target endotoxins, which are toxins that are related to staph bacteria, kind of a natural product that is not a medication that can help to reduce inflammation. All of those strategies are now in step two. And step two is done simultaneously with step one. Step two is where you're going to be thinking about doing dilute bleach baths. Maybe you're scared of dilute bleach baths, so you're utilizing chlorine pools. Maybe you don't have a private chlorine pool. That's when hypochlorous acids or products that have that endolysin technology, like Ladskin and Hypothesis, can be utilized. And if the skin looks infected, that's when you would probably be utilizing either an antifungal or an antibacterial medicine. And then again, shout out to Nia. An infographic is in the middle of my eczema action plan because there are specific ratios of bleach and water that you'll utilize for eczema management with a bleach bath. Then step three, if you have gone through step one and two, and the skin is not to healing in particular areas, that's where your provider should be talking to you about the specific medicines that they want to use in a specific area of the body. I have the steroids listed there as we need it, but I also have the expectation. If, for example, you're utilizing triamcinolone on the body of an infant, then I actually expect that that rash should go away in about 1 to 3 days on average. And then the green arrow says that if the skin is clear or almost clear, now you're back up to the green zone for that area of the body. And look at that. We don't have steroids assigned in the green zone if you're not flaring. But this is an algorithm. If the skin flares again and you've got red, bumpy, itchy skin in the same area, then you got to go back to the yellow zone. You got to switch back over to moisturizing balms and ointments. You got to get on top of products to control the microbiome. And then you need to use the assigned medicine that your healthcare provider has talked to you about. They also have listed here all of the non-steroid options that we can consider utilizing for younger babies. And so this is a tool that you can just Google Eczema Action Plan. Nia is also taking an interest in eczema action plans and kind of customizing and creating like specific elements that kind of hit all of that holistic piece that we're kind of talking about here. But I hope that you could even consider printing an eczema action plan that you like, taking it to your appointment. If you don't live in Phoenix and you can't come and see me here, then use this and advocate for your kiddo, because I can't tell you how many times my families have been so grateful for having a plan that they can get text to their phone that they have at all times. And it really synthesizes all of the really main important pieces to their eczema care. Next. I kind of laid out the different domains in this table so that you could take a screenshot and kind of like have that on hand if you're in front of your healthcare provider. There's also a little bit more on long-term planning that you can consider, but I also added this to the presentation just for your reference. Next. And now we're to summary. So just reminding you that in this discussion, we talked about the importance of skin, gut, and just normal developmental maturity, and how waiting for that maturity to set in can really provide you that relief as your baby gets older, that there is a light at the end of the tunnel. And as the skin and the gut mature, perhaps your child is the kiddo that is going to get better enough to where they're not going to be battling with moderate to severe eczema. I pray that that's the case for you. There's also a growing body of evidence around treatments, prevention, and management of eczema from traditional and integrative models of care, but going to the specialists that have a keen interest in this area can be highly important, as well as the safest route for seeking care for your infant and newborn. Focusing on a holistic model for your child ensures that a family-centered and customized care plan for each individual is developed. And there are really great evidence-based tools that can make your eczema journey easier. It can help you to stay more organized and really work for your needs as a family and a caregiver. Next. So this is me all done up and fancy when I was doing a video for Nia. So this is fun stick pins that we have when we go to Expo. A QR code here if you guys are interested in getting in touch with me at my clinic, whether you live in Arizona or not. I'm always available for scheduling an appointment to just talk about what you're doing with the holistic side of eczema management. If you don't live in Arizona, then medication prescriptions are definitely not an option because I'm not licensed anywhere except for Arizona. But scanning that QR code gets you to the website, and we can have good discussions about holistic eczema management. And you can learn about all the different treatment options that you have if you don't have anybody really near in your area to discuss that with. This is also the time for questions and mostly just an appreciation. I know that you're here either as somebody who has a child with atopic dermatitis or you're a provider that's really interested in learning about infant atopic management. And I hope that this was helpful for you, that you can take away some really useful information that you haven't heard of before. And mostly, I really just hope that your patients and your kids get to healing. And I hope that that journey is a little bit easier now for you. Thank you so much for your time.
Thank you so much, Sam. That was really wonderful. I know that,
Thanks.
I'll stop screen sharing so we can get to a Q&A, since I know we had some great audience questions come in that I would love for us to take some time to chat about. But, I know that this can be a really stressful time for parents. You have this new baby, new child, and then you're navigating, all of these different elements of their care and how to best provide for them on top of this. So hopefully, our viewers, our audience, you're taking away some tips you can take directly to your provider, directly to those specialists, to create that eczema action plan and to really feel, empowered in your care and in all of these different little aspects of, behavioral and, when it comes to food and, all of these little pieces that make
So
up
many,
care plan.
so
So
many pieces. Yes.
yeah, I know. I saw that table and I was like, that's a great table to screenshot because, just having that as an easy reference, I think will really help. So really
Yeah.
appreciate that. Yeah. So great. Let's get to some questions now. I'll pull up our Q&A here. All right, so the first one I'm seeing is from an audience member who says, I found that dairy milk and yogurt early on would trigger my baby's eczema, so we cut them out and she's much better. I saw you mention not eliminating foods totally. At age 3 now, should I be introducing dairy milk again?
It's always a really great consideration. Hopefully, your child has had dairy elements in their diet, either eggs, some sort of yogurts. If they haven't, and you slowly introduce those and see that there are reactions, then the challenge with completely eliminating is that you might have increased the risk to now have a full-blown allergic reaction versus just an irritation. And so, always doing it with caution, more baked foods, or maybe not straight like chugging a big glass of milk, but tiny bits to assess that. And yes, I do encourage that you do try to implement that back into the diet as long as there's no reactions. Maybe you're not going gung ho every single meal for the day has dairy, but certainly a few times a week to kind of build up that tolerance.
Great. Thank you. I saw a thumbs up there. So
Mhm.
those are great kind of considerations to have as well, and making sure that, you're doing so thoughtfully, I think is really important. So great. So I see our next question is around latex and latex allergy. So they said, I thought that latex was the number one allergen, and consideration around like baby tethers and toys. I think she's just curious about, how you would approach like latex being a potential allergen, I think.
So, just for consideration, contact allergy ingredients, those number one spots, that isn't necessarily from like the contact allergy like institution per se. Those number one spots actually change yearly in the top tens. When it comes to latex, you always want to go into it with sensitivity and also understanding that there's cross reactors with latex, bananas, avocados. And so if you don't see reactions with bananas, avocados, but you see reactions with latex, then you're still totally fine. If you do see reactions with latex, then don't use that product, but you don't need to be super careful if you haven't noticed any major reactions in that immediate response of
Mm,
the exposure.
hmm. Great. Thank you. That's helpful. Well, another thumbs up. Great. So I'm seeing our next question, is if my child has eczema at age 3 and doesn't get diagnosed with dairy allergy till years after, could their dairy allergy ever go away? Oh, that seems similar to the last one. Interesting. So I guess, uh,
Lots of discussions about the dairies, the eggs, the
yeah.
peanuts, the wheats, glutens, around diet and atopic dermatitis. It's a really good representative of the where families are at right now with foods. And really, every person's journey is very individualized. You need to first see, is there a real life exposure that causes you a reaction? Step one, worry about that thing. Then take it to step two. If it seems like it is an anaphylactic type of response, hives, swelling, vomiting, things of that nature, difficulty breathing, then that's when you do need to include an allergist. The in between irritations can be trickier. But I would say that any food that you're concerned about, you would want to proceed with caution. If it's not a true allergic reaction, small little bits throughout the week as tolerated, not completely eliminating, because completely eliminating or never even introducing to begin with, research does show us that you can accidentally increase the risk of developing the allergy. And so talking with your pediatrician and your allergist is really important to understand what that goal is, and also understanding what the goal is for each food. You may get a test back and you've got 5 to 10 different things that you're worried about, but you need to understand specifically for each food what that looks like. If it's not safe now, but is it going to be safe in a year or two? And so going with those types of questions with any testing is really important so that you're not accidentally completely eliminating a food and now accidentally increasing that risk for the allergy.
Interesting. Yeah, and I think we had sort of one question in this same vein, which I'm curious about as well, which is someone asking, should a parent avoid introducing a food allergen while their baby's eczema is flared? So is there sort of a difference between, waiting until they're in more of that green zone from the eczema action plan, for example, and introducing foods
There
then?
are some Eczema is thankfully coming into a time where there's a lot of these really smart questions and hypotheses that science is catching up with. We don't have really strong data or protocols to say, no, you shouldn't be introducing the new food when you're in the flare. But there are new research that's coming out that when you're flaring and getting things introduced like foods or different environmental allergens, maybe that does make the whole trajectory worse for you. But that's challenging because if you have a child with moderate to severe eczema, and we know that you can flare almost 6 to 9 months out of the year, then that means that you're also not introducing all of these new foods to your baby. So that's really why finding those specialists that are really unique and really want to drill down to all of these things with you with pediatric eczema is highly important, because each kid will also probably react a little bit differently. So have a discussion with your provider so you could better understand what that safe plan looks like for them. Good
Absolutely.
question.
Thanks. That's great. So I have a question on the eczema action plan from an audience member. Under flare control step 1, it mentions probiotic mixed with ointments. So they're wondering if you have a kind of topical probiotics that you recommend. I recall in your presentation that you said, of course, in consult with your providers, with your specialists around, the types of probiotics that you would introduce, the frequency, et cetera.
Mhm,
But I guess
mhm.
this audience member is wondering if there are general, brands that hold to high standards or that would be good for this.
So I'll give a shout out to Jennifer Karen Brand, because she's a pediatric nutritionist that talks a lot about specifically a lot of these key concepts of nourishing the skin. And that's where I actually learned about probiotics mixed with lotions on the skin. So the probiotic that commonly is utilized for that are ones that can come in capsules. One specifically that I know that I asked my parents to use is from Megaspore. You can open up the capsule, put that in something like a balm or a lotion, put that on the areas that are flaring, try it on a test site at first, of course, and then alter as well, be giving a little bit orally. I also like prebiotics because prebiotics are building up that commensal, that community bacteria that we want to be in the gut in that 0 to 6 months of age that we talked about in maturity. But the probiotics are also kind of helping to die off the things that became overabundant. So that synergy of the two, but the pros specifically mixed on the skin. You must have very good vision to catch that little piece on the eczema action plan. I have had one younger child who I believe had topical steroid withdrawal. And that was one piece of their treatment plan, along with non-steroid medications. That family mom told me specifically she really thought was a helpful aspect to healing on the skin that was severely thinned and cracking and peeling and doing really wild changes. But she really felt that adding that probiotic mixed with the lotion on those areas of skin was very healing.
Absolutely. Yeah, I think that's a helpful place to start for sure. Great. So many questions, which is really great to see. So we'll just keep Keep right
Keep
going.
on going.
Yeah.
Yeah.
I know this is a big topic with a lot in there, so I'm not surprised. So we have another question, which is, could you speak on eczema, breast milk, and allergy testing for kids under 6 months who haven't started solids yet? What should I know as a mom, and what questions should I ask of my providers as well?
So you always want to continue breastfeeding if possible. I hate, or not hate, it makes me really sad when my breastfeeding moms come in and they're only eating broccoli and very few foods because they're so worried about giving their babies exposures from your food. And that's what we don't have yet. We don't have an understanding of the foods that you eat and when it gets how much of those protein goes into your breast milk and at what timing that your baby eats that and how much protein are they getting from that breast milk to cause a problem. So for my breastfeeding moms, I want you to remember that piece of nourishment, both for yourself and for baby. I also want you to remember that diet eliminations have been found to not be helpful unless you see an actual reaction from problems. I had a mom who really never ate peanuts. They never ate nuts. Then when they had a lot of trail mix on a vacation, they noticed that their baby did flare after that. And so while it is difficult to know the timing of our foods through the breast milk into baby, if you are a mom who doesn't eat a particular food and then you do, and then you see the flare, that's just part of your kind of food journal diary, noticing that there is a flare with that, and then watching for triggers associated with that. But I'd say, in my experience, most families come in and the moms are dairy free and very strictly dairy free. And they've been doing that for a couple of weeks and they haven't seen improvements. So if you do a diet elimination, at least for a few weeks to see if there's an improvement. And if you don't see an improvement in the eczema, then you need to slowly add that back into the diet and then go on to the next food. But highly encourage breastfeeding. Breast milk on eczema can be super helpful. I'd say that of my families who do it, they don't see grand results. And so saving breast milk for ingesting rather than on the skin may be more beneficial depending on the nutrition status of your baby. And not eliminating things and asking your pediatrician if you feel that you should be referred to an allergist in that early age. Remember, it's the 4 to 6 months of age where you want to start introducing some of these highly allergic, high risk foods. And so having that discussion about getting there faster than waiting for 9 months, 10 months of age, you might have missed the boat and catching early introduction benefits.
Absolutely. Great. Just a couple more questions here, I think, before we wrap up for the evening. So I have one that's sort of a two-part question from an audience member. The first part is using beef tallow evidence-based? I'm guessing in this case for infants or children. And then the second part of that question would be, can you share about vitamin D and eczema for infants as well?
Yeah, so vitamin D does help generally with inflammatory skin conditions. Here in Arizona, a lot of us are actually more vitamin D deficient or insufficient because we don't get a lot of sun exposure because it's so hot. So we do know that vitamin D, it can be either even applied topically in particular skin disorders, calcineurin inhibitors, or sorry, not calcineurin inhibitors, vitamin D analogs, like calcipotriene is actually a topical ointment gel that you can put on the skin to help the vitamin D get absorbed into the skin more readily. A little bit more specific for psoriasis, not really specific for eczema. But lots of products these days have vitamin Ds for babies. Your vitamin D may be fortified in your formulas. It's always a discussion to mention to your pediatrician, but there's a lot of over-the-counter vitamin Ds. And when you're supplementing with vitamin D, the concept is that making sure that that vitamin D is in that healthy level can have evidence that it helps with inflammatory skin conditions. With eczema is one of those conditions that it falls under. When it comes down to the beef tallows, I do have to say that I could wear a badge that says I'm not sure about the beef tallows quite yet, and I do feel that it is a little trendy. We had a little badge at Expo maybe 4 or 5 years ago that said, yes, I've tried coconut oil and no, it didn't work. And beef tallow may or may not be on a badge like that in a couple of years. I would say that a majority of my families who have used beef tallow didn't find that it was very helpful. But if you have access to it, if it's an affordable product for you, it's not something that I think is dangerous to try, but it's definitely not top priority, and it unfortunately doesn't have any evidence based. And anecdotally in clinic, I would say probably only about 25% of families say, like, oh, it made such a big difference. And it's very expensive. And so I would recommend skincare products that have better technology in it with that higher price tag than comparatively to a small jar of the beef tallow.
Yeah, I think it's a good question. I'm sure a lot of people are curious about that. Anytime new things kind of come into, the conversation.
Very trendy. Oh,
Yep.
yes.
You
Mhm.
wonder like could this be the thing for us but again if it's new, right? You're just working off of anecdotal evidence or we don't have that research or yeah, so I
Yeah.
think those are all things to consider.
Things to consider. Yeah.
Uh, all right, so I think we have just one more question here, and then we
Okay.
should be able to wrap up. But
Okay.
no, National Eczema Association, of course, where we are available. If you have questions, we have great resources on our website too. So this last question is about glycerin. So it says, are products containing glycerin, i.e. Aquaphor, better to use than products without, i.e. Vaseline?
So usually in ointments, you'll see a little bit of mixture of the petrolatum, the glycerins, the dimethicones. Those are all really great ingredients that we don't really worry about. You want something to be occlusive in certain areas, but you also want to remember that ointments are made to be purely occlusive, not always hydrating to the skin. And so that's why the balms I feel are really important because those are actually designed to add hydration into the skin, and then the ointments on top are really mainly a protection. So I don't have problems with either of those types of ingredients, but lanolin that I mentioned earlier is unfortunately at least in the Aquaphor ointment. It's not in like the Eucerin creams as much anymore. I haven't seen that listed there. But lanolin is a top 10 pretty common ingredient for causing a skin allergy, and it's also a pretty highly recommended product for families to use. And so, while I don't have problems with all of the Aquaphor Eucerin line, you just want to be mindful that any lanolin ingredient does also accompany with a really common incidence of contact allergy. And when you have other options that you can try, you would want to steer away from those ingredients that you know can cause issues. And lanolin was actually contact allergen of the year 3 or 4 years ago.
Interesting.
Yeah.
Okay. That's helpful to know. Great. All right. Well, I really appreciate, the audience engagement we've had here. I know this is a really big topic, and hopefully this has been helpful to you all. I know that it's been helpful to me, and just in getting kind of a great overview of all the aspects that go into this holistic sort of eczema management and care for infants and toddlers as well. So I want to thank you again, Sam, for helping us get a better understanding and wrap our heads around this collectively.
Mhm.
And like I said, many thanks to all of you for joining us today, for, really just taking the time to make sure that you have the resources that you need and that your kid or kids need as well. So I think it's really wonderful. Um, so you can continue your eczema education on our website at nationaleczema.org/webinars. And again, on behalf of the National Eczema Association, thank you so much for joining us and have a good night.
Hi, everybody. Thanks for coming.